as we have reached to this slide where we can see the pars distalis having a cells. You can see the rich cell network, and you can see the lot of sinusoids such as here, and then you can see a lot of cells with lot of granules. You can see the two distinct types of cells. These are stain. One is stained with the eosinophilic pink color dye, another is stained with the bluish color dye. So pink color one, they are basically the acidophilic cells, and other cells which are having the what we call it as the basophilic, they are basophilic cells, and few of the cells which are lightly stained, they are chromophores. Now we'll move to the next slide as a tables. What are the secretions of pituitary gland? Chromophore stains weakly and includes including stem cells and differentiated progenitor cells. Now we'll go to the secretions. So what we see two types of acidophilic cells. One which is called somatotrophic cells, which are acidophilic in nature. They are maximum in number, around 50% of total number of cells, and they secrete the growth hormone. This growth hormone is pulsatile in nature, more in the early morning and sometimes in the evening hours. Early morning means growth hormone. What is basic function of growth hormone? Growth hormone increases cell mass. It is having a positive ionotropic effect. So how it acts? It doesn't act directly on the target cell. It acts on the first on the hepatocytes, and once they act on the hepatocytes, from there a substance like called as insulin like growth factor which has been secreted. One of the example, in a growing bone, this insulin like growth factor affects on the epiphyseal plate and the growth of the cartilage, and once the cartilage grows, the length of the bone increases. So can we add few of the clinical importance? Yes. What we can add? We can say that increase in growth hormone level will give rise to gigantism. If there is a less growth hormone in the child, then it leads to dwarfism. What happens in adult? As you must have studied in physiology, it gives rise to acromegaly. So there are few applied importance what we talk about the somatotrophic hormones, or we call it as a growth hormone. Another hormone which is called mammotrophic, again acidophilic, 15 to 20%. What is basic secretion? Secretion is prolactin. Prolactin plays a very much vital role right in the secretion of the milk, and also it regulates high prolactin levels, reduces the secretion of follicular stimulating hormone and LH, and also inhibits the what we call it as the lactational amenorrhea, where we get a no suppression of the graphene follicle or suppression of the follicles in the. So prolactin applied importance in a primary infertility in a female. If there is increased prolactin level, it affects on the fertility because there is reduced ovulation. So we have a drugs against the prolactin. One. Second thing is that prolactin during pregnancy increases. So number of cells, prolactin secreting cells increases. What happens in there? There is one of the condition what we call it as prolactinemia, where the increased pituitary gland size, which may affect, there are so many structures as we are going to see in the cranial fossa, many structures are closely related with the pituitary. So what happens to them, we will talk when we will talk about what happens to prolactinemia. Many times women just after the delivery can lead to the loss of gradual vision. That is one of the things. So we have to think about in the sense that probably it is prolactinemia. What is amazing fact about this? Fact is that previously we used to open the skull cap to identify the pituitary tumor and remove it. Now because of the advent of the laparoscopy, we can approach from nasal cavity and we can reach to the pituitary fossa and can remove the prolactinemia. Next, another thing, hormone, which we have dealt in great detail. Now these are the three types of cells which are basophilic in nature. You can see gonadotrophins, as we are very well versed of that. Gonadotrophins 10% of total cells, forming the follicular stimulating hormone. Then luteinizing hormone, both of them plays a very important role in the regulation of ovarian function. No need to tell about that, we have dealt it so many times. Then thyrotrophic cells secretes one of the important hormone called as TSH. Thyrotropins are only 5%. As we have said, thyrotropins are minimum in number. They secrete thyroid stimulating hormone, which has a crucial role to play in the development. In the we are going to see next organ, that is thyroid. We are going to discuss in detail how it affects, what it does. And a third hormone, that's called corticotrophic cells, which secretes ACTH, which is very well known, adrenocorticotrophine hormone. Stimulates adrenal cortex, which secretes the especially the mineralocorticoids and glucocorticoids. And another thing is that it plays important role in the metabolism. Now as we go ahead,